Welcome back. You're watching McLaren Port Huron's Today's Health, and I'm talking with Dr. Michael Basha about treatment for lung cancer. Dr. Basha, what are treatment options for lung cancer?
Well, there are many different treatment options for patients with lung cancer. Of course, everybody knows about chemotherapy, usually provided by the medical oncologist. There's radiation therapy provided by the radiation therapist. And in certain cases, we can provide a potential cure for patients if they have limited disease, especially if they have non-small cell lung cancer, stage 1A, 1B, 2A, 2B. And thoracic surgeons are real helpful there because they may be doing surgery on the patient to remove the lobe or section of the lung and offer the patient an actual cure.
What are clinical trials and how might that benefit a patient with lung cancer?
Well, that's a really exciting thing, especially with the new Karmanos Cancer Center here. Clinical trials offer patients therapies which are novel, therapies which are being tested to see whether or not they have benefits. These are therapies which aren't offered to the general public. These are clinical trials run by large centers. These involve such things as particular drugs or certain radiation regimens which may not be offered to the general population, and they're exciting because they offer patients therapies which are only typically these patients are only able to get at bigger institutions. So these are clinical trials in an attempt to sort of break new ground or offer patients therapies that might have benefits beyond what is currently being used on most patients with lung cancer.
Could a clinical trial be applicable or available in any stage, or is that something typically that's more available for patients with in stage 4?
It can be in any stage, actually. So there are therapies which might be offered to patients with earlier stage, or in patients who have more late-stage disease or end-stage disease. A good example of that is that stage 2A and 2B patients with non-small cell lung cancer used to only be treated with surgery. Now we realize if you combine surgery with chemotherapy, it offers a patient a better outcome. So these are things that were trialed with clinical trials, and it was determined that combining surgery with chemotherapy in stage 2A and 2B lung cancer was better than surgery alone.
How about radiation therapy? When is that helpful?
Well, radiation therapy is helpful in a number of different cases of lung cancer, and nowadays we're doing more targeted radiation therapy, something we refer to as stereotactic radiation surgery, or even small stereotactic body radiotherapy. So what radiation is able to offer patients now is, in years past, we would provide a radiation to a large area of the body that was affected, and there was a lot of spillage, so to speak, of radiation into healthy tissue, and it would cause damage to these healthy tissues. Now we can do more targeted therapy, which is directed right at the cancer. It provides higher energy levels, which will kill the cancer cells, but will not have any effect on the healthy tissue surrounding the tumor.
Wow, amazing. Now I know the Karmanos Cancer Institute at McLaren Port Huron is open. And how is that benefiting cancer patients?
Well, again, I think it provides, we mentioned this during the break, but I think this provides sort of a multi-specialty, multi-modality option for patients with cancer. So the patient is going to be exposed to a lot of different types of doctors, lung doctors like myself, surgeons, radiation therapists, medical oncologists, and they're going to also be exposed to lots of different procedures and treatments, bronchoscopy, fine needle aspiration, electromagnetic navigational bronchoscopy, stereotactic body radiotherapy, and other clinical trials which might help the patient in the long run.
Are there advances in the treatment of lung cancer?
There are, and I mentioned already the beneficial effects of doing surgery combined with chemotherapy in patients with non-small cell lung cancer, stage 2A and 2B. Another big area that we've not touched on is looking at various gene mutations in lung cancers, and this is especially important in patients who have non-small cell lung cancer, especially adenocarcinoma. There are certain gene mutations. One's called the epidermal growth factor receptor, and the other one is called the ALK gene, which stands for anaplastic lymphoma kinase gene mutation. And if we can identify these gene mutations in patients with non-small cell lung cancer, we can provide a more targeted therapy, which is better for that patient.
this is all, as I'm listening to you talk, I just realize how complex it is and how amazing it is that patients can access all of these options here at McLaren Port Huron.
Yeah, it's really amazing, and I think it's going to, take the hospital in a great direction down the road, because it really does offer patients, as I mentioned, many different doctors and many different treatments to help them through, what is a very difficult time for them.
And we talked a little bit too on break about at what point would you as a pulmonary critical care specialist become involved?
Well, we usually are involved early on because, Mrs. Smith, for example, goes to her primary doctor and has a chest x-ray for whatever reason, and all of a sudden they see a spot or a nodule, and then the patient's referred to us. So we start the ball rolling with a CAT scan or a PET scan. We decide what kind of biopsy technique we might use. We make a diagnosis, and then based on the diagnosis and then the staging, we decide what doctors to employ: medical oncologists, radiation therapists, or surgeons.
You've talked on and off about a cure for lung cancer. Is that something that patients should even have at the back of their mind as a possibility?
Absolutely. If you are diagnosed with non-small cell lung cancer, which is one of the special types of big categories of lung cancer, especially if you're early stage, 1A, 1B, 2A, 2B, certainly with a combination of either surgery alone or surgery with chemotherapy, you can be offered a cure.
This has been very hopeful. Do you have any closing comments?
Well, I think the major thing is understanding that 90% of lung cancers are related to tobacco use and cigarette smoking, and so I think as physicians and others who who have if patients or friends or relatives who smoke, it's important, very imperative that we get these people to stop smoking as soon as possible, because that's the major risk factor there.
Thank you so much, Dr. Basha.
Thank you for having me.
Stay with us. We'll be right back.